And given how competitive it is, and football being a contact sport, it's not unusual for players to get injured. Unfortunately, I had several roommates get injured during the course of their college careers, and so I was able to witness firsthand uh, the time and effort that they put in for rehab and to try to make it back onto the field. And then again, that introduced me to orthopedic surgery. And I like the idea of getting individuals back to the athletic field or relieving pain, helping them with their mobility, and just getting them moving. So that was a big piece.
Wow. Would you say that your athletic background gave you really great insight, especially in the field of sports orthopedics?
I think it really allowed me to bring another perspective to the discipline and to the specialty. It's not uncommon for patients to come in and they'll say, well, I went to see another provider, perhaps another orthopedic surgeon, and I'm having issues with my knee. And they said, well, just don't do that. Don't work out, and don't do what they love to do. And so I feel like part of my role is in building that rapport, trying to understand what drives the patient, what motivates them, and allow them to be able to continue to do that. And if they need to take a period of active rest or rehab, I always try to encourage them to continue to move and continue to be active and pursue their passion.
That's really amazing because, as an athlete, especially if you're doing a sport that you love, the last thing you want to do is be out from your sport. So, as an orthopedic surgeon who knows the side of the athletic side, but also knows the side of the medical side, you're able to really put the two together and with the relationships that you create with your patients, put them on a path that can truly help them and guide them back to where they need to be.
That's correct. There are a number of factors. So I'm listening and gaining information from the athlete, perhaps a parent in the case if they're a minor, and then having an understanding of the pressure that the athlete has to get back on the athletic field or the court to perform. And so there's a number of dynamics, and certainly coaches, by and large, have the best interests of the athlete in mind, but they're getting paid to, excuse me, to win games, and so there's this pressure to get everyone, to get the athlete back onto the athletic field and competing. So the challenge for me is how do I take all those things into consideration, excuse me, and get the athlete competing and active again without endangering their health further.
And it's all about balance, trying to find that balance in order to get them back to where they need to be.
Absolutely.
And
Absolutely.
again, truly amazing on what you're doing. You're really helping the athletic side of it. So tell me a little bit more about the general population that comes into your office for orthopedic needs.
It really does vary. I will have young patients that are homeschooled and they're tennis players, pickleball. I get a lot of rugby players with various injuries that compete in the local rugby clubs, high school athletes. Then I'll get older individuals in their 40s, 50s, 60s that are active golfers, tennis players, runners, high intensity interval training, CrossFit, individuals like that. So a lot of times it can be, excuse me, just individuals that are competing in an organized sport, or they're weekend warriors, if you will, and participating in activities that they enjoy. So it runs, it is pretty diverse with respect to age, gender, and lifestyle. But the goal is very common in that empowering them with information and understanding what it is that motivates them and getting them active.
Wow. So you really work with a diverse group of people. And would you say that majority of your patients are located in this general South Florida area?
I've had a number of patients come as far as, from Miami.
Wow.
I'm affiliated with a couple of human performance centers, and so they'll send athletes. But I would say, all three counties, but I cover primarily the southern part of Palm Beach County. But as far north as Port St. Lucie, and as far south as Miami, but generally the South Palm Beach County area.
Okay. So for our listeners watching today, would our listeners need any type of referral to come and see you? How does that work on your end?
Yes, so I'm on a number of insurances, and most of the patients are either, and it really depends on their insurance. I mean, to be honest, I have staff, and people ask me all the time. I say, I don't know, ask the staff. Honestly, don't know. But
Yeah.
it really depends on your insurance and what they require with respect to prior authorizations, referrals. And so we do have staff that can help you with that. So if you call the office, they can assist you with that and explain to you what would need to be done in order to come in.
That's perfect. Okay, so now we are going to get ready for a quick commercial break, and we'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory has ailments. Exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. Questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, listeners, and welcome back to You and Your Doctor. Again, we are here with Dr. Patrick Tyrants. Welcome back. So Dr. Tyrants is the owner of Tyrants Orthopedic. They are located at 6290 Lytton Boulevard, Suite 101 in Delray Beach, Florida. They're open from Monday to Friday from 9 a.m. to 5 p.m. and you can contact them at 561-898-0303. So, Mr. Tyrants, after going through a little bit of your website, I was very interested about your approach that you take to orthopedics. Can you tell us a little bit about your approach that you take to orthopedics at your practice?
Just my approach in general with medicine, I pull, again, from a lot of different perspectives, that of an athlete. I did some training in nutrition and health coaching, so I understand the idea of the importance of food in your diet. And for example, if I do a rotator cuff surgery, I'll get a measure of a patient's blood glucose over an extended period of time. It's called a hemoglobin A1C, and I'll add that to my set of labs, in part because I know that if it's elevated, there's an increased chance that the procedure will fail. I'm not sure if a lot of orthopedic surgeons do that. But also, I make recommendations with respect to, as I mentioned before, their diet. I try to stay away from, as much as I can, steroids, which can be damaging to the tissue, particularly if they're used used repeatedly. I like to use supplements as an alternative to inflammation. Some cell therapies that can help with tissue healing, and so again, if I don't focus solely on the surgery piece, I really feel like it's my job and it's my duty to keep them off of the surgical table. And so I do what I can to do that. Now, not all patients are like that approach. Some of them will say, "Well, you're the surgeon, you're the doctor. Fix me." They want a magic pill, a magic bullet, and want the surgery, not do the therapy. And so I try to weed out those patients, or at least get them on board with their plan of care, and say, look, in order for you to have an optimal outcome, in order for you to have experience the quicker healing and to get back to where you were before, you have to be an active participant. So that tends to be my philosophy.
So for your patients that do have to undergo surgery, do you incorporate the natural aspect to some of the supplements as well as the therapeutic side as well to help them with, I guess, an active recovery?
I do. So my practice, I've been open for a year since I've been in South Florida. So some elements I'm still implementing, but I will, depending upon the patient and the circumstance, will recommend IV infusion, say for vitamin C is great for tissue healing, wound healing, decreasing rates of infection. It helps with cross-linking collagen and helping to restore tissues. I may add some cell therapies with some interventions that can augment healing as well. But I'd stay away from narcotics or minimize them. So I'm not one to prescribe a lot of narcotics, particularly if they haven't had surgery. I'll add supplements that'll decrease their narcotic requirement. So there's a number of things that I can do to help them, again, be more active. And for example, if they're having to take a lot of narcotics, they're not going to be as mentally focused, and it can cause other side effects. It may decrease their how quickly they are able to get back to their job. So there's a number of factors that come into play.
That is very interesting and very important. Work in your field, you probably work with a lot of young athletes, and with the opioid epidemic that is going on in this country, I feel like it's such an amazing that you use the natural benefits of this world in general, the supplements, the therapeutic treatment, so that these young people don't have to go through the possible battle of getting hooked on those narcotics, because you see that within the young people nowadays.
Yeah, you do. The vast majority of individuals who have become dependent on narcotics, many of them have gotten it, through prescriptions that related to surgery and or to deal with chronic pain. So and it really doesn't take much time, or you don't have to be on a narcotic for an extended period of time before you're dependent. So again, as an athlete and someone who did things naturally and had to work harder and eat better than the next person and not really take shortcuts, I tried to do things as naturally as possible.
And again, it's I know I keep on saying amazing, but it truly is, because surgery alone is tough, but imagine dealing with a narcotic issue on top of that because of the medicine you're prescribed. So truly amazing what you're doing here. So is there anything else that you would like to add for our listeners watching tonight about Tyrance, orthopedics?
No, I mean, I'd love to have you come in, and we really try to do our best to create a positive atmosphere, a patient-centric atmosphere. Doesn't feel like a doctor's office. The staff is great. You come in, I can tell you some jokes. You'll like my jokes, and we really do our best to put you in a good mood. And we have, we really do have great outcomes. So I like it. I like it. I think you'll like it too.
Do you have any mottos at Tyrance Orthopedics?
I mean, there's a number of things. I mean, health is wealth is one thing. I like the idea of youthful aging. Oftentimes we talk about, anti-aging, but I say that which you resist persists. So, we all grow older, but the idea is to age youthfully, youthful aging. So as you get older, you have that energy and you have that
still
vigor.
Have those youth components.
Yeah, exactly.
That's all.
Exactly.
I love that.
So youthful aging.
I really do love that. Well, I just want to thank Dr. Tyrance for coming on to our show today.
Thank you for having me.
This was another episode of You and Your Doctor, sponsored by All County Healthcare. Again, you are able to watch us on AMP2 TV, as well as listen to us on 96.9 and 95.3 FM. Again, I am your host, Rayma Phillips, and join us next Monday at 6:30 for another episode of You and Your Doctor. Have a great night, everyone.
Bye-bye.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer